Thank you for joining us, and welcome to our webinar on the Social Impact Partnerships to Pay for Results Act and the key takeaways from the SIPPRA NOFA. Before we get started, there's just a couple housekeeping things we want to go over. This webinar is being recorded, and it will be posted online after we're done. Give it a week or so. All participants in the webinar are currently muted, so you can only hear us and our lovely voices. If you have any questions, we will be having a Q&A at the end of the presentation, so please, as you think of them, type your questions or comments into the questions box, and please include your name and organization. And finally, if you're interested in following along on Twitter, you can do so with the hashtag #LiveAtUrban. Today's presentation is broken into 5 sections. We'll begin with some introductions to the team and to Urban. We'll move into some background on the legislation that created the NOFA. Then we'll talk a little bit about the NOFA itself and how you can engage with Urban. And finally, in the last 20 minutes or so, we will take your questions and answer them. So hi, my name is Rayanne Hawkins, and I'm a policy associate with the Research to Action Lab of the Urban Institute, and I'm joined by my colleagues Brian Beertz and Will Engelhart. Will is a training and technical assistance manager who has a background in social work, and Brian is a fellow policy associate with a background in housing. My background is at the intersection of pay for success, procurement, and criminal justice. The Urban Institute is a policy research organization with a mission to open minds, shape decisions, and offer solutions through economic and social policy research. Will talk a little bit more about our 12 different research centers and groups, but the center that we're part of, the Research to Action Lab, takes all the work from Urban's various research centers and tries to translate it into actionable strategies for policymakers. And before we get started with all the information about the actual NOFA, we wanted to take a minute and provide a disclaimer that all of this information is based on our interpretation and best understanding of the SIPPRA legislation, Pay for Success, and the Notice of Funding Availability. If you have any specific questions about the application elements or whether or not your organization might be eligible, you should direct those questions to the Treasury Department. They have both an FAQ on their website as well as an email where you can reach them, SIPPRA@treasury.gov. Now I'll provide a little bit of background on the legislation and Pay for Success. So what is Pay for Success? Pay for Success is an innovative financing mechanism where investors provide upfront capital to a social service provider who goes through an evaluation to determine whether or not the services that they're providing are having the intended outcomes for the population that they're serving. And if the evaluation proves that they did achieve those outcomes, then the government will repay the investors. Just to make this a little bit more realistic, we'll talk about the example of Denver. The city county of Denver wanted to do permanent supportive housing for about 250 individuals. And so they created a project where foundation investors and a regional bank gave the upfront capital to the service providers who then are currently delivering the supportive housing intervention. And the evaluator is Urban, it's actually the Urban Institute, and we're doing the evaluation right now. And if the outcomes of jail bed reduction and increased housing stability are met, then the government will repay the investors. Now we'll talk a little bit about the legislation that allowed for this NOFA. So the Social Impact Partnerships to Pay for Results Act, also known as SIPPRA, was passed in February of 2018 as part of the Bipartisan Budget Act of 2018. It created a $100 million fund that can be used to scale pay for success projects. The legislation required that a lot of the money be spent on children with outcomes effect, or the money that is for outcome payments be made for children. So we'd like to talk about pay for success in 4 different stages. The first being feasibility analysis, where you do a study to determine what the political, programmatic, or other risks are to a project that might lead to it not being successful. The next step is transaction structuring, and that's when you'll hear Brian talk a little bit more about later about a partnership plan. And during your transaction structuring is when you would put together that plan, figure out the outcome payments or the outcomes that you want to tie to payment, and bring all the partners together. The next stage, implementation, is where the service provider actually starts performing, and they are implementing whatever services like permit supportive housing and wraparound services. And then at the same time, there's an evaluation. Now the NOFA that was just released has about $66 million that will cover outcome payments and evaluation. It's important to note that there will be another NOFA released later in 2019 that will have money for feasibility analysis. So Pay for Success has been done in a wide variety of topics. There are just over 25 active projects, and these are the primary topics. You can see we've got criminal justice, maternal and child health, workforce. A lot of these same outcomes are actually featured in the NOFA under the 21 outcomes that Brian will talk about later. But what's important to note is that some projects touch on more than one outcome. Let's take Denver as an example. It's primarily a homelessness intervention. However, the population that it serves has high involvement with the criminal justice system. Now I'll pass it over to Brian, who talks a little bit more about the actual NOFA itself.
Thanks, Ryan, and welcome everyone to our Thursday lunch hour webinar on the SIPPRA NOFA. So the NOFA, a couple of big takeaways. First, as Rand said, there's about just a hair more than $66 million that's going to be made available to support outcome payments and evaluation. And about half of that, or at least half of that, will have to be awarded to projects that are focusing on children. It could be more than 50%, but they wrote in there at least 50% of the awarded amount has to go to projects focusing on children. There is a central rule for evaluators. Evaluators have to be independent and impartial. There's also a dedicated funding stream for evaluation. Up to 15% of your project costs, or about $9.9 million out of that $66 million, can go to support evaluation. SIPPRA also requires rigorous evaluations. So the preferred method is RCTs, or randomized controlled trials. This is the most rigorous form of evaluation method that you can do. However, quasi-experimental designs, which use comparison groups and other statistical methods, they are acceptable as long as you justify sort of why you're using that and not an RCT. And the reason for these rigorous evaluations is that the outcomes that you want to claim, you have to demonstrate very conclusively that your intervention is causing those outcomes and then causing that value to the federal government. Some other takeaways, Applications are now due in less than 90 days. So the NOFA was published on I think about a week ago, maybe a few days less than that. So they are now due by May 22nd. For applicants that are interested, Treasury is also strongly encouraging that they submit notices of intent, but that is not required. Treasury expects to make their decision sometime in November and award between 5 and 15 projects, although they could award fewer than that. The expectation is just 5 to 15. The projects can run for 7 years with 6 months for the evaluation, so that total period is 7.5 years. And state or local governments must be the applicant. There's no requirement for cost sharing, but once you get into the NOFA, you'll see that you may need some additional funds because of how they structured and how they'll determine the value of the outcome payment. Basically, what you want to take away from this is that your projects mostly, they need to be mostly baked or shovel ready or what other term you want to use to say that it's pretty much come together. You're not at the beginning of project design. You probably have a pretty strong idea of what you're going to do. So who's going to be at the table? Pay for success in general requires usually government end payer, service providers, investors, intermediaries, and an evaluator. This NOFA, similarly, you need the same set of actors. State and local governments, as I said, they are the applicant. The service provider is going to be delivering the intervention, so they are a must. Investors and intermediaries, not required, but most likely you will have them in your project and among your partners. The evaluator, definitely have to have an evaluator. They need to be independent and impartial. And so you can see we separated them here in this list of partners to emphasize that fact that your evaluator has to be independent and they're actually paid a little bit differently than everybody else. When you're thinking about who's at the table and putting together your partnership agreement, a couple of things are going to go into it: roles and responsibilities, your service delivery plan, which outlines how the intervention will work, your evaluation plan, which we'll get into in more detail because it's really critical, your data sharing plan. Big thing here, you need protections for privacy for the data that's being collected. And then your payment scheme. Treasury says in the NOFA that it's really important that in your payment arrangement, you make it clear that all of the partners understand that payment is contingent on achieving those outcomes. So what outcomes can you do? As I said, and we've said a couple times, there's a huge focus on outcomes related to children. 50% of the total awarded amount must directly benefit children. However, there's 21 listed outcome areas, with the 21st being a very broad and other things that can generate federal cost savings. You can see by what we've got here: employment and earnings, education, recidivism, health, homelessness, financial stability, family. Pretty broad in terms of what's acceptable, and pretty much every existing pay for success project, almost every existing one, could fall under one of these 21 outcome areas. Oh, and just to note, the full list is available on pages 5 to 7 of the NOFA. The really key thing, though, with outcomes is you have to think about the value to the federal government. So the NOFA requires, and as we've got quoted here, that basically the extent of the payment that the federal government will make is equal to or less than what they calculate the value to the federal government to be. And there's this formula that's in the NOFA. Again, I want to direct your attention to pages 12 to 14 for the full description. But there's this formula in there that basically calculates value using two different things: change in revenue, and change in spending. Change in revenue, this is basically any increases in taxes. So you can imagine if you've got a workforce development program that increases income for participants, this would then increase revenue to the federal government through more tax revenue. Or you could reduce spending, or reduce, I think the phrase they use is federal outlays. So you can imagine if you reduce the amount of money the federal government spends on Medicaid or some other type of program, that will generate savings to the federal government, which will then be calculated as a value that your outcome payment, or that the outcome payment is related to. A couple other things you want to think about with cost and payment. One, applicants must use budget impact analysis. Budget impact analysis, this is an approach that estimates the annual and cumulative effects on federal revenue and spending. It usually involves estimating the baseline federal revenue and spending for a target population, and then estimating any changes that result from the intervention. As you can see, we have up here Treasury as expected. It's expected the Treasury will release a budget impact analysis tool that we believe will be available on the SIPPRA website. So look out for that. It'll help you calculate what the value to the federal government will be. As I said earlier, the intervention must be the cause of the cost savings, and the evaluator, one of their roles will be to certify those cost savings or value. Value or cost savings must also count for if a program, and this is a term they used, oversubscribed. And they say basically you have to figure in if there's a wait list for the program, and if that is going to affect the overall value to the federal government. And then finally, one other key point is that the Treasury or the federal government will only make one payment per outcome. You can have more than one outcome that the federal government will support as long as it has value to the federal government. But for each of those outcome areas, they will only make one payment. This is really important for pay for success because oftentimes projects have interim outcome payments. So you need to figure that out with your investors and other people involved in the project. So moving on, evaluations. As I said, evaluations, they have to demonstrate causal impacts. RCTs are the preferred, or randomized controlled trials are the preferred method called out in the NOFA. This is randomized controlled trials work by randomly assigning individuals to either a treatment group or a control group and then comparing their outcomes. And this randomization procedure really helps to reduce any chance of bias creeping into your program, so you know that any outcome you do receive, any difference, is the result of the intervention. Quasi-experimental designs, they try to replicate this using comparison groups and some other statistical tools. Rigorous quasi-experimental designs are also acceptable. Like I said before, you just need to explain why you're using that and not an RCT. Finally, just a couple of things to highlight on the evaluation plan. They spell out in detail, I believe it's 17 different components that your evaluation plan must have. Things like evidence, demonstrating why you think the intervention will achieve those outcomes. Your research questions, your metrics that you're going to be using to assess success. Implementation fidelity, so how this is going to work and how it will be carried out in the local context. Data sharing procedures, your logic model. Logic model is basically a tool to show how you think the intervention is going to cause your outcomes, and then also your evaluation methods. And again, I want to call your attention to a specific part of the NOFA. This is pages 16 to 20, where they talk about in more detail what goes into an evaluation. And now, just to sort of bring everything together, this is the scoring table that exists in the NOFA. So once you put your package together and you submit it to Treasury, one of the steps will be to score your application. There are two main buckets to call your attention to. And this is sort of, if you're multitasking, checking email, this would be a good moment to pause that and really listen, because, 80% of your points, so here 50% is tied to achieving outcomes, 30% is tied to evaluation. So those two buckets account for 80% of the scoring for your application. And you can see that they're broken down a little bit further. So the evidence demonstrating your intervention can be expected to achieve the desired outcome, that's 15 points. Your other parts that show that this project will actually be feasible, 20 points, and then 15 points for project partners. On the evaluation side, you can see it's 20 points for your design and your metrics, and then also 10 points for the actual evaluator that you pick. So this is, are they independent, and do they have the experience and the capacity to actually carry out this fairly complicated project? And you can see that 10 points is actually equal to the value to the federal government. So this scoring rubric weighs that the same as the value to the federal government. The other thing here is that it's good to show savings to state or local government, who will likely be, through their position as an applicant, maybe even an end payer. And then finally, the capacity and commitment to sustain the intervention, that's worth 5 points. So the scoring, that's going to occur during step 2 of what Treasury lays out as a 5-step process. Not going to go into all details about the actual review process. Just want to highlight that the scoring occurs during your subject matter expert panel review. That's step 2. The first step is just, are all your pieces there? And then also steps, I believe, 3 and 4, there will be some assessment of the actual applicant, which can override some of the scoring. So it's really important to check that language out in the NOFA. And then finally, the other thing to be aware of is that while Treasury will make their determination sometime, or at least make the announcement sometime in November, we expect, they may negotiate with the applicant beforehand to work out the budget. And so, there might be an intermediary step of figuring that out before the actual awards are made public. And as we said, potentially 5 to 15 sites. And so now I'm going to turn it over to Will to talk a little bit about connecting with urban.
Thanks so much, Brian and Rayanne. Before I jump into it, just a reminder that we're going to, after I'm done speaking, get to the question and answer period. So you can put your questions in now as they come to you in the right-hand box on your screen there. But just before we get to that, you've heard a lot today so far about pay for success and general takeaways from the SIPPRA NOFA. But we wanted to take just a moment to talk quickly about some of what urban has to offer those of you looking to help navigating this space. And just in particular, the fact that Rayanne went very quickly through a pretty complex pay for success model quite quickly, and then Brian went through a 65-page notice of funding availability quite quickly. So there are a number of other resources that may be helpful as you are jumping into this space. First and foremost, I hope many of you have had a chance to view Urban's Pay for Success specific website, pfs.urban.org. I'm hoping some of you came to this webinar through that website, but if not, please do check it out. It's listed there on your screen. We have a number of Pay for Success specific tools that I'm going to talk through a bit, FAQs and resources that should be helpful to you all if you haven't checked it out already. In particular, I want to point you towards our SIPPRA Week landing page, which is highlighted there on the right of your screen. In there, we have a number of posts that cover a lot more than we've had a chance to get to today. They include a blog post with FAQs about the NOFA, similar to what Brian just covered. We also have an overview of our Pay for Success project assessment tool and early childhood education toolkit that can provide guidance to sites interested in applying to SIPPRA, and are particularly helpful on the early childhood education side, knowing that 50% of funds, at least 50% of funds, go towards projects directly benefiting children. We also have a post that provides guidance for cost and evaluation considerations, and that is particularly relevant for folks thinking about determining the value of federal savings and local and state savings for your project as specified in the NOFA. And then also a blog on the role and membership of the U.S. Commission and Federal Interagency Council on Social Impact Partnerships that Brian just talked through a little bit. Long story short, throwing a lot out there at you, but we have a ton of information on SIPPRA on our website right now, so please go check it out, and we're hoping to present more on our website in the coming days and weeks. So as I was saying, having a lot on our website, we've also developed a number of detailed resources that were put together before the SIPPRA NOFA was released, but we think they could be particularly useful for scoping out SIPPRA-funded projects or components of Pay for Success projects in general. So on the right there, we have our project assessment tool and our early childhood education toolkit that I talked through quickly, but the project assessment tool can really be helpful for thinking about SIPPRA readiness in your jurisdiction. And the ECE toolkit is particularly relevant with that focus for the NOFA on directly benefiting children. I also want to highlight the Making Sound Cost Decisions brief that we have that some of our colleagues put together. Again, this was put together before the NOFA was announced, so it wouldn't speak to some of the specifics of how the federal government is expecting value to be determined, but it does generally talk about identifying cost estimates and such for Pay for Success projects. Also, particularly relevant to the NOFA are these two products on the bottom left and in the middle there on the bottom about evaluation for pay-for-success projects, and particularly starting with randomized control trials for pay-for-success projects. As Brian noted, RCT is expected to be the starting point for evaluation for the NOFA, and so this can really provide a deep dive into some of those materials. And then finally, we imagine many of you will be focusing on health-related projects if you are interested in SIPPRA, and we have a number of resources, including this brief on pay-for-success and healthcare. So Rand spoke a little bit just about urban at large. The three of us are from the Research to Action Lab, but generally, Urban is a nonprofit research organization that believes decisions shaped by facts rather than ideology has the power to improve public policy and practice, strengthen communities, and transform people's lives for the better. That's basically our mission statement there, but really just want to highlight that we have a number of experts across a number of fields that are either immersed in pay-for-success or immersed in the content area and evaluation that you might be interested for your project. So they're in communities and working to gather data to assess whether efforts across a range of social and economic policies and programs are effective. Specifically, we have 12 research centers, and our experts are implementing rigorous evaluations on research areas focused on children, adolescents, youth and families, aging, crime and justice, education, health and health policy, housing, poverty, vulnerability, the safety net, and many other areas of impact. And you'll notice that all of those also hit on the 21 areas of focus in the NOFA. So there's just a lot of expertise at Urban around a number of the issues you might be interested in. Additionally, wanted to highlight Urban experts' roles as evaluators, and specifically on pay-for-success projects. So we have staff across our research centers who are managing evaluations that are active right now on pay-for-success projects. I just want to run through a couple of them quickly. Rand mentioned the Denver Social Impact Bond Project, and in Denver we have evaluators who are running a randomized control trial and also a process study on a permanent supportive housing program where they're tracking housing stability and days in jail, among other key outcomes, over 5+ years. We also have evaluators in Massachusetts Juvenile Justice Pay-for-Success Initiative who are implementing a 7-year-long randomized controlled trial to evaluate high-risk youth intervention models of young men leaving the probation system. They're evaluating the number of jail and prison bed days avoided, job readiness, and increases in employment, among other key outcomes that they're tracking. Finally, wanted to discuss the U.S. Department of Housing and Urban Development, HUD, and the Department of Justice, DOJ, who launched the Pay-for-Success Permanent Supportive Housing Demonstration Project in 2016. HUD and DOJ are conducting a formative evaluation to assess whether providing permanent supportive housing within a pay-for-success framework is successful and cost-effective, and Urban is leading this evaluation on behalf of HUD and DOJ. All of this is to say Urban evaluators are in a unique position of having significant expertise in how to evaluate PSS projects across a range of programs, policies, and practices, and they're really just hopefully a great resource for the field on both pay-for-success and thinking about implementing and evaluating programs and practices. We also have staff who have expertise, not necessarily in evaluation, but on providing technical assistance around pay-for-success. So I've highlighted a couple different areas that we'd be open to providing phone calls with folks that are interested in reaching out to us about SIPPRA or just generally about pay-for-success. So certainly we can provide some guidance on designing rigorous evaluations, including randomized controlled trials or quasi-experimental designs as highlighted in the NOFA. Also, just generally, we've been providing technical assistance to a range of sites about pay-for-success. So if there are general components of pay-for-success projects that you have questions for us about, please reach out to us. If you're looking to identify interventions and tracking outcomes for programs that directly benefit children or are working through this process of, as Brian said, maybe a more shovel-ready type project, we can provide a lot of guidance around that, as well as some discussion around estimating value or cost savings, if it were, for potential projects, and also thinking through how to use administrative data for evaluation and your program design. So I'd encourage you to reach out to us if you have questions on SIPPRA, but also just if you have questions about pay-for-success generally. So I'll point you back to our pfs.urban.org website, And right now on the right-hand side of that website, we have our Ask an Expert tab, which would ask you to reach out to us and you could provide a little information of what your questions are on. Or if you prefer, just to email us through email, pfssupport@urban.org is fine as well. That's pfssupport@urban.org. Kind of my whole point is just we want to be a resource to you all in the field. This work is really complicated, and we hope we can help you navigate it. So please reach out to us. Putting up my email as well as Rand's and Brian's, or again, a link to our website if you do want to reach out to us. But we just hope to be helpful, as this webinar might be useful, but we imagine there will be a lot of specifics that you'd want to unpack as well. So with that, I'll kick it back to Rayanne, and we can start the Q&A process moving forward.
All right, thank you, Will and Brian. We still have time to answer your questions, so if you have something that you're just urgently, eagerly waiting, please type it in now so we can have the opportunity to answer it. I have our first question here, and I will answer it. It's what kinds of programs might produce value in excess of the federal outcome payment? So just a quick note, haven't really done a thorough kind of budget impact analysis. However, it's important to think back to the slide that Brian presented on the equation for value. And projects will need to either increase revenue and or decrease spending. So what this kind of means is that the savings is likely to come from interventions that either increase revenue, like Brian said, potentially a workforce development program, or that reduce costs to large federally funded entitlement programs such as Medicare, Medicaid. On the latter example, you could imagine a early home visiting program where there are healthier weight babies and the mothers are also healthier, and it reduces Medicaid spending, for example. The next question we have here is for Will. It's, can service providers apply to SIPPRA?
Thanks, Rand. Yeah, this is a really relevant question, a great question. Service providers can do so, but only in partnership with the state or local government, with the government as the primary applicant to the NOFA. So just the point there is that state or localities, and in the NOFA they describe what they mean by local government, county, city government, even entities underneath those governments must be the main applicant. But the expectation is that they would partner particularly with service providers in the community, possibly investors, and then independent evaluators as well. So yes, service providers can, but just not as the primary applicant, if that makes sense.
Thanks, Will. Our next question is for Brian, and it's, can existing projects apply to SIPPRA?
So there's nothing in the NOFA, the Notice of Funding Availability, that we read that seems to preclude existing projects from applying, as long as they meet the other aspects of the, laid out in the NOFA around evaluation, evidence, and value to the federal government. Ultimately, it will, of course, be up to Treasury and the boards that are created to score the applications. But, going a little bit into some opinion on our part, you could imagine an existing project maybe wanting to scale. They've already got a model, they've got the partners in place, and they want to scale. They believe there's value to the federal government. That might work. But there's nothing in the NOFA that says it has to be entirely new projects. So potentially.
So our next question is for Will. It says, can you define the age range for children?
Yes, the NOFA is pretty clear about that. I can't remember exactly what page it's listed on, but when they're talking about benefits to children, they're talking about people aged under 18 years old. So any age from 17 and below is what they define for children. And I don't think they go into what they mean directly as benefits, but yeah, that would be just generally the area of focus there.
All right. Thank you, Will. And our next question is, I'll go ahead and take this one. Can the applicant be the investor? And the answer here is no, they can't. The state and local government has to be the primary applicant. I think the investors, however, would be part of, as Brian was talking about, the partnership plan if they are going to be involved. So the next question, this one is for Brian. Could the feasibility study be performed by the applicant, or does it need to be a formal outside study?
So I'll say most feasibility studies, I believe, have been done by intermediary organizations. So intermediaries, for those of you who are not familiar, are organizations that provide a lot of technical assistance and really put these projects together. Social finance, third sector, CSH have been some of the big ones in this space. They bring together the investors. They usually have some experience working with the investors. They have the staff that's capable of doing the budget, the analysis, cost savings piece. But for the question, does it have to be sort of a formal outside study? The answer is no. You could do it yourself in-house. I would also point you to our project assessment tool. If you've done some in-house assessment of a project, or you put an analysis together, I would point you to our project assessment tool to run through and see if you've got all the components that you would need for a strong application. Again, that's on our website. It was one of the tools that Will talked about.
So our next question is for Will, and it's, how do you suggest we secure an evaluator when funding isn't secured and we are beholden to our procurement processes?
That's a great question, and I might ask Rhiannon to jump in on the procurement side of it, but just on in terms of securing the evaluator question of the funding not being secured, that's spelled out in a little bit of detail in the NOFA as well, and they go to the point of stating that the evaluator is the one partner in the project where funds are not directly tied to outcome payments. So as long as the evaluator achieves the goal of completing the evaluation as agreed upon in the agreement and submitted through the NOFA, the evaluator is guaranteed those funds, and it's not directly tied to the outcome payment. In terms of some of the local procurement processes for determining evaluation, I generally suggest you to reach out to us if you have questions for that, and we can provide more guidance on how to potentially partner with an evaluator. Rhiannon, I don't know if you have anything to add there on procurement.
I don't know what the timeline were. Unfortunately, the timeline for the actual NOFA is quite short, and so I don't know what how long the local procurement process is, but I know that early on, when it came to pay for success projects, a lot of localities used requests for information just to kind of survey the field for who might be interested in becoming a partner in a pay for success project, and a lot of times those led to more official project partnerships. So if you have the ability to do a request for information, that might be one option. But not all procurement offices do those. So the next question is for Brian. When you say 50% of funds must directly impact children, do you mean 50% of the total federal grant amount or 50% of each project's funding?
So that is a great question, a great clarifying question. Our read is that it's 50% of the total federal grant money. So say the federal government awards all $66 million, 66 and change, then about $33 million would have to go to projects that directly benefit children. The other $33 million could go to other types of projects that may or may not benefit children. So you could, for example, have a criminal justice program where everybody's over 18, or you could have a homelessness program or anything like that. It's just, yes, the overall total amount, half of that has to go to projects. But for your individual one, that does not necessarily have to be the case.
Thanks, Brian. Our next question is, the NOFA states that the outcome should be achieved as a result of the intervention over the duration of the project. Is that the duration that an individual is actively receiving services, or could cost savings result after the intervention, but within the 7 years? Well, that's a very good question, and I'll pass it over to Brian.
Sure, yeah. So I believe that it's just within that 7.5 year period for the evaluation. But yeah, it's just within that period. So if say you deliver an intervention, person has great outcomes, I believe you could track those outcomes, even if they're no longer directly being served, if they're still being benefited. This is where your evaluation is going to be really key because it depends on what you're tracking for that comparison or control group. I would, for those kinds of very specific technical questions, I would also encourage you to give a close read to the NOFA and reach out to Treasury if this is something you're really concerned about or you want more clarity on.
Thanks, Brian. The next question is for Will. Can the state be both the investor and service provider?
Yeah, that's a great question. So there's nothing in the NOFA that would make us believe that cannot be the case. Just very clearly, the state or local government would need to be the applicant. And I'm assuming when folks are saying investor, they mean also potentially the end payer or the end payer of a potential project, and the state could serve that role as well. And then as a service provider, certainly the state could serve the role as a service provider. So there's nothing in there that we saw that we think would make that unlikely. So please, yeah.
So a follow-up question to what was just discussed about feasibility studies came in. It said, would using the Urban Institute's project assessment tool constitute a feasibility study? And I'll take this question. And in general, feasibility, our project assessment tool is a great first step, but it's not quite as detailed as a feasibility study. A feasibility study usually gets into more detail on the target population, on the intervention that's actually going to serve them, and the evidence behind it, and makes a strong argument that there's a possibility that this population, based on previous studies or another pilot of in the same locality, would benefit from actually doing the Pay for Success project, and also that their outcomes would change enough to that you could see it, so there's sufficient population size to realize the change in outcomes and to use those outcomes for payment. And generally goes into a little bit about how you might, a little bit about cost and value as well. So the next question is for Will. Did the NOFA provide any information about how to capture cost savings that benefit multiple programs across federal agencies?
Yeah, great question. I imagine a number of you are having some questions around that. When Brian went through the information on how the NOFA describes federal value and looking at both savings and revenue increases to determine that, that's really where most of the information came from on pages 12 through 14 of the NOFA, as well as some other areas that cover that. They don't necessarily have more information on how they're exactly expecting folks to measure this at the time. The expectation is that the evaluator would be the partner to certify this information and report on it to the Treasury at the time of when you're expecting an outcome payment. So the evaluator would be the one to determine that information. And they have said that they will be developing a website that will be available on the budget estimate calculations that can be used, and hopefully that could guide some of these discussions as well. And I know we had some other questions that came in about when to expect that website to be available. And again, we are not directly tied to Treasury, so we don't know when that will be available. So apologies there.
Thanks, Will. This next question is for Brian. What is your opinion about the limitations of RCTs? They tend to do well with direct cause effect, but for complex adaptive systems tend to have multiple influencers, not just one intervention is the solution. For example, with chronic health conditions, they don't typically do well with just one RCT-determined intervention. Any thoughts about this in the stringent structure of the NOFA's requirement for RCTs or quasi-experimental designs?
So this is another great question, and I'm going to answer it two ways. One, with pay for success, these tend to be single projects. There are some examples of some people developing somewhat more complicated pay for success projects with sort of like multiple things going on at once. But I will say for the vast majority, they are single projects, usually delivering services, 200, 300 or so people, which seems to be a little bit outside of sort of what you're saying with this multiple influencer, more than one intervention. So that might be a bit of a tricky knot to untie with this funding mechanism. The other thing, the other part of this, I really like the question about the limitations of RCTs. So I will say, yeah, there are, and in our work, we've identified, talking to local communities, there are some concerns about some of the limitations of RCTs. As the questioner points out, they are great for determining these cause-effect relationships, which is a key consideration for the NOFA, but sometimes there are issues actually setting up, the randomizing, like maybe your program doesn't really allow for it, or maybe you want to serve everybody and you don't like the idea of diverting some people into a group that's not receiving the same program. These are all things that you would work out. Those types of limitations are really great things to work out in partnership with an evaluator who really knows all the different options that are available and can come up with, pretty creative solutions to some of these problems, particularly if you're getting into more of the quasi-experimental structure of an evaluation. There are a lot of times ways to maintain a very rigorous method, but accommodate some of these practical challenges that exist when you're doing something on the ground.
Thanks, Brian. The next question is for Will. If a nonprofit does not have an existing relationship with its local or state government, who or what department should they contact to form one? Is it realistic to think that one can form a relationship quickly enough to apply by the deadline?
Thanks, Rayanne. So for the first part of that question about identifying a local or state government department to work with, a lot of that would depend on what program you're thinking of implementing or intervention, and who you are as a service provider or nonprofit thinking about your pay for success engagement. So reach out to us. We could help with thinking through some of those specifics just generally. And then that question about if it's realistic to form a relationship so quickly by the deadline. You've heard us say this a couple times, but it is a very fast deadline of being less than 90 days now, and there's a lot that's expected to go into developing this for receiving those outcome payments. So that does seem ambitious, from my opinion, to form that relationship and think about implementing the program at this time. But do reach out to us about that. And then also, we talked about this quickly, but Treasury has identified their plans to release a feasibility study, NOFA, likely later in 2019, and that could maybe be a better place for someone in your position to think about those funding opportunities. But I hesitate to tell anyone not to think about these types of opportunities, but it would be a very fast turnaround, yes.
So I'll take the next question. Are payments only made when federal revenue is accrued, i.e. the person is paying taxes because they are employed, or just when the outcome is achieved, i.e. the person has a quality job? So this is a good question. The the NOFA states that the outcome payments will be made after the evaluator certifies the cost savings value and also certifies the outcome has been achieved. So the payment should be made when the outcomes are achieved and certified by the evaluator. Our next question is for Will. Are there any housing authorities currently participating?
Yeah, so we don't actually know who is applying or planning to apply currently or as an organization necessarily, but in the NOFA, they do highlight that local public housing authorities do actually count as a local government entity, and we can follow up with the page numbers of where those definitions are listed out, but they would count as a potential applicant if that's also what this is getting at, and they could be the agency to apply directly through this. So can't speak to whether public housing authorities are planning to or have considered reaching out through this process, but certainly can if they're interested.
And I'll also just tack onto that with some of the existing projects, particularly, as you can imagine, the homelessness-focused projects. Housing authorities have been a partner for a lot of them, bringing some resources such as vouchers that can make a project feasible.
Thanks, Brian. Our next question is, are there any requirements around scale or number of people reached through the initiative?
So I don't believe so. I don't remember reading any requirements around scale or the number of people being reached through the initiative. I will say that there are some just aspects of pay for success and evaluations that sort of point to at least a floor, maybe not a ceiling for participants. So really, you can't have like a rigorous evaluation in most cases. Don't want to be too overly general here, but if there's only 20 people in the program, you're probably not going to be able to set up a rigorous evaluation. Most of the existing ones, at least 150 or so, I think is the smallest one that I'm aware of. So that's kind of where you're thinking a floor might be. But some of them go up to, especially ones that expect to deliver services over a number of years, several hundred people.
Thanks, Brian. So the next question is, can a state submit multiple applications from different agencies? So there's nothing in the NOFA that would prevent that from happening. However, there is going to be a review process where all of the applications are scored at the same time. And so it's probably a good idea to make sure that there's some sort of state-level partnership coordination before submitting multiple applications, just to make sure that they are distinct and that they don't somehow, that the multiple applications don't somehow detract from one another. The next question is for Will. Do partnerships need to have investors secured prior to the proposal submission?
Sure, that's a great and nuanced question there. There's nothing in the NOFA that states that investors are required as part of the application. So if the government entity had the funds available to apply without an investor and had identified a service provider and an evaluator, they could move forward with the application without the investor necessarily on board or an additional investor. But they do identify for those investors signing onto a partnership agreement. I know Brian had gone through a slide of some of the processes there, and there's a bunch of details in the NOFA on if there are investors, the importance of going through those agreements and having that all shovel ready, if you will, or fully defined for the NOFA application. So not a requirement, but if you are bringing ones on board, yes, you would want to have that information detailed.
And I would also just point to the scoring rubric where your project partners are one of the things that you're going to be scored on. So if, just keep that in mind when you're thinking about who you need at the table. So do we have time for
I think maybe
one more question?
more question. So this question is, I'll give it to Brian. The NOFA speaks to increasing employment opportunities and high school graduation rates. Could there be a case for funding adult education programs, including GED type programs?
So I would point you to the big consideration there. Are you creating value for the federal government? Employment and workforce development is not one of my areas of focus, so I can't really speak to any specific programs. But I could imagine where if you've got a program that is helping people get their GED, I believe that is sort of correlated with higher incomes, where that might then generate higher incomes and then therefore tax revenue for the federal government. So I'd look at your evidence base if you've got a particular program in mind. If you can see Washington State Institute of Public Policy has some really good cost-benefit tools around a lot of programs, including workforce development ones. But just look at that, look at your evidence base, and see if you can really achieve those outcomes that are of value to the federal government.
All right. Well, thank you everyone for joining us today. It's been wonderful to hear your questions and to get this opportunity to talk to you more about the NOFA. If you have any questions that we didn't get to, you should please feel free to email us at pfssupport@urban.org. And also the webinar will be posted, and it contains all of our email addresses, so you can feel free to email us directly as well.
Thank you all.
Yeah, thank you so much.
And have a wonderful afternoon.